I think the most important thing when you're considering cosmetic surgery is make sure you've given yourself enough time to think about it. Yes, by all means do the research behind the procedure and make sure you found your right surgeon, but it's really important you make sure that this is something that you want, because changing a face can really change a personality, can sometimes even change the way people think about themselves and how other people think about you. We spend a lot of time counseling patients. I insist patients come a minimum of 2 times to see me before surgery, so that we can ensure that really what they're asking for is what we're looking to achieve. At Symmetry Clinic, what we find really useful and what our patients love is the 3D digital imaging program we have. This is a really fancy piece of software where we take pictures of our patients in 3 dimensions and really can do almost a virtual operation on them to kind of show them what it's going to look like after the surgery, so they can have some confidence in that. Now, of course, we're dealing with pixel manipulation and not tissue manipulation, which can be 2 very different things, and therefore we can't ever guarantee those results. It'd be great for me to be able to just press a button and have a 3D printer or a robot achieve what I show patients on the screen, but I don't think that's going to happen in my lifetime. So you hopefully are going to rely on my surgical skills to get you the very best result. Nonetheless, having that 3D imaging system really makes sure that the patients and I are really singing in that same hymn page to ensure that what we are going to achieve for the patient is really what they want. Often we find that patients have a very different aesthetic ideal to what might be mine, and we try and ensure that all the time these 2 things are very close to each other. There's no point in me trying to impose an aesthetic ideal on a patient. Equally, if the patient has very unusual ideas or ideas of what they really think is achievable and I don't think it's achievable, it's very important for me to be able to convey that to them before the operation. I like to think we provide a holistic approach here. We spend a lot of time looking at patients' faces as a whole. Often we get patients, for example, coming in seeking rhinoplasty surgery, when actually that may only be part of the problem or not even the problem at all. It could be, for example, that their chin is rather small, or they have other features which, when enhanced, might actually make the nose look fairly normal. So it's not just about looking at one area, we look at the whole face as a whole. And that's the beauty of Symmetry Clinic. We're really dedicated to the face and everything about the face to make sure that that feature that you may not like or the patient may not like isn't the only one that we look at. We pride ourselves in trying to provide as 5-star service as we can. Our post-operative care is really critically important. Of course, we want you to have the best surgical result, and part of that is not just the actual surgery itself, but also the pre-operative counseling and spending time in that post-operative period to make sure that you're really doing all the right things to optimize your post-operative result. We spend a lot of time educating our patients on how to deal with the nose, for example, post-operatively, in terms of massaging it, taping it, putting ice packs on. Things can heal in an unpredictable way, but the reality of the situation is with good post-op care, we can minimize these things. We make sure we see our patients often and really educate them to ensure that the post-op care is optimized.